Good morning. My name's Marla Kincaid, and I am the president of the California Crisis Intervention Training Association. Welcome to our second training. Today we have the honor to hear from our partners in Ventura County. And let me give you a little overview of the presentation today, and I will then introduce our three presenters. Ventura County, following a series of officer-involved shootings of persons with mental illness in the late 1990s, law enforcement leaders in Ventura County were determined to find a better way to deal with the increasing violent contacts between officers and persons with mental illness. With the help of Major Sam Cochran and the San Jose Police Department in California, Ventura County built from the ground up a county-wide collaboration between NAMI, behavioral health, and all law enforcement agencies in Ventura County. Ventura County CIT has continued to grow and become stronger by finding funding sources, utilizing technology, and building partnerships. So with that, I'd like to introduce our three guest speakers. Mark Stadler has over 33 years of law enforcement experience. He became the Ventura County Law Enforcement Crisis Intervention CIT Program Administrator in July of 2015 after retiring as a commander at the Ventura Police Department in California. Commander Stadler is a founding member of the Ventura Program CIT program in 2001. He holds a bachelor's degree in criminology and a master's degree in organizational management from the University of Laverne. He is a Law Enforcement Medal of Valor recipient, a graduate of the California Police Officer Standard and Training, Supervisor Leadership Institute, and Command College. He is an instructor at the Ventura County Criminal Justice Training Center and has been an adjunctive professor at the University of Laverne since 2007. Mark is a member of CIT International and is a very valued board member for the California Crisis Intervention Training Association, also known as CACITA. Thank you, Mark, for being here. Our second presenter today is Felicia Skaggs, who is a clinical administrator for the RISE expansion, assist programs for VCBH. Felicia has been in the mental health field for over 20 years, beginning in Kern County. She has managed supporting housing projects for individuals with serious mental illness, programs for individuals with dual diagnosis of substance use disorder and mental health disorders. Felicia was part of the Kern County Mobile Evaluation Team in its initial stages, being dispatched by law enforcement to go to crisis calls in the community and involved with substance use disorder treatment inside the county jail system. In 2015, Felicia began working with the Ventura County Behavioral Health to manage the RISE program, which is a grant-funded program to outreach and engage difficult populations. This role requires Felicia to interface and work collaboratively with law enforcement, businesses, faith-based organizations, schools, community-based organizations. Felicia has developed collaborations with law enforcement, which was instrumental in the award of additional grant monies to create the RISE expansion, where case managers are now paired with officers full-time to manage clients who are high utilizers of emergency services. Felicia is also a trainer with CIT Academy in Ventura County and is a member of CIT International. And third but not least is Scott Walker. Scott Walker has been a CIT program assistant for 11 years. He got his start in law enforcement as a volunteer at the police storefront, followed by being a police explorer and then a police cadet, while completing 2 associate degrees. After receiving a bachelor's degree in sociology, Scott switched professional goals and began working in the mental health field. Scott has worked with the developmental disabled adults living independently in the community. He's worked with at-risk youth in residential settings and in the community with adults with substance use issues in a residential setting. He has a master's degree in psychology with an emphasis in marriage and family therapy. Scott has a genuine interest in finding the common ground between first responders and mental health providers to better serve those with mental health symptoms. So as you can see, we have three fantastic presenters today, and I'd like to turn it over now to Mark. Thank you, Mark.
All right, thank you very much. Appreciate that introduction. That was nice. One of the things I want to start off with is just as a note, as a board member, I can tell you that one of the reasons we're doing this speaker series is to highlight all the different programs in the state of California. You know, there's a lot of counties and communities doing fantastic work. And we thought in time of COVID, it'd be a good idea to get this series out and let people know what's going on. So the idea is not to like say one's better than the other. We know every community has different needs, and what we're highlighting is what works for us here in Ventura County. So with that, I'll get started. All right, so this is what our organization looked like when we first got started with CIT, and then this is what it's grown to today. And this is actually only partially covering all the agencies involved. One of the things that is unique about Ventura County is that we're actually the only county in the state of California that has every single law enforcement agency in the county doing the same CIT program, Memphis Model CIT. We literally have everyone, Cal State Channel Islands, the park rangers, FBI's recently joined us, and community college police. So it's kind of makes it nice to have everyone in the area on the same page. But to give you some background on how we got started. So in the late 1990s, we had a series of officer-involved shootings in Ventura County. And because of the loss of life, loss of officers, you know, if not physically, emotionally, loss of public confidence, civil litigation, it led our law enforcement leaders to say, you know, there has to be a better way. And thankfully for them, that there was a couple things going on at the same time. There was a major lawsuit in the county, and you know, the recognition of how things could be better. The leaders were looking at different types of programs. And why me? Why did I get involved? I was asked if I was interested, and I volunteered, but my interest in the field came very early in my career. I started my career with Santa Barbara Police Department, worked there from 87 to 1990. And I had the unfortunate experience very early in my career, about 6 weeks after I finished field training, I was involved in an officer-involved shooting. In fact, yesterday was the 33rd anniversary of my officer-involved shooting. November 9th, 1987, went to a call of assault with a deadly weapon in progress. Subject at the hotel had, he just basically snapped that night. He was in a crisis state, went out into the hotel hallway where he was staying in downtown Santa Barbara with a machete. And he ended up attacking the hotel manager and another tenant. Both of them lived, but they had significant injuries from being attacked by the machete. That led to us arriving on scene. And for me, as a brand new officer, and first time I'd ever handled a call with this other officer, he came up with a game plan as a senior officer. And being a new guy, not having a better idea, I said, okay, let's do it. And so essentially that he ended up charging toward me, swinging the machete, and then I shot and killed him. And what, you know, for a long time, people asked me like, well, what would you have done different? And I would used to say, well, nothing, you know, he charged at me and I responded to it. But then as I thought about it, you know, I would like to have taken the time to talk to him, to say, you know, what had gone so wrong in your life that it led you to today, to you having me take your life. Because before we were using the term suicide by cop in this area, and it was pretty clear that that's what the situation was. Pretty unique. His mother actually called the station wanting to apologize to me for what her son had put me through. Obviously, that's not something that happens very often. They were aware of his situation, and they were convinced that because of his religious background, that he couldn't take his own life, so he had me do it for him. So research and collaboration, how we got started, we partnered very early on with Ventura County Behavioral Health. They're important partners with the CIT program. And we also collaborated with National Alliance on Mental Illness. So in doing our research, we came across the Memphis Model CIT program. And I always have to give Major Sam Cochran a shout out for the CIT program that they started in 1988. And they combined with the University of Memphis and National Alliance on Mental Illness in their area to help create the program. And the reason I always give him a shout out is because I cold called him one day and in 2001 and said, hey, we want to start a program. And he answered the phone when I called, and he spent an hour on the phone with me, giving me ideas and tips and hints. And it definitely set us on the right path in 2001. San Jose Police Department allowed us to go to their training class. And to their credit, after we finished the class, we told them we wanted to start our own program. And their generosity, they handed us all their material, their videos, everything they had. They said, it's all yours. You can plagiarize whatever you want. So it made our jobs that much easier. And we were able to start our first academy 6 months after we had gone through the training ourselves, which Major Cochran thought was crazy, but we were able to pull it off. And it was just due to the collaboration that we had built early on. Initially, it was Ventura Police, Ventura Sheriffs, and Oxnard Police were the three main police agencies. And later we added 3 other local agencies that were important parts of our partnership. So the goals of our program: we want to reduce the intensity of a crisis using de-escalation strategies, reduce the necessity for use of force. We try to promote pre-custody diversion and collaborate with mental health consumers and their families, the community, and the stakeholders to build and support a vibrant and accessible crisis system. I know that sounds lofty, but that's always is our goal. We hit rough patches along the way, but since we got involved in this in 2001, we're constantly working to make improvements and make things better. So we follow the Memphis model. So it's a 40-hour class. We do 3 classes a year, approximately 40 per class, and 67% communication operators are trained in Ventura County, and 90% of patrol officers. This is where we vary a little bit from the Memphis model. Memphis model recommends that you train 20% of your organization as specialists. Our law enforcement leaders made the decision that they wanted everyone trained 100%. And as you know, there's pluses and minuses of that. You never want to try to force people into training because they don't get as much out of it. But we have found that best example I like to use, a few years ago, we had a sergeant went through the class. He had about 22 years on the job. He decided to go through CIT because he had just become the sergeant over a task force that was dealing with the homeless mentally ill. And he came up to Scott and I at the end of the class and he says, you know what? He says, I've been fighting going to this class for 15 years. He goes, it's the dumbest thing I ever did. He says, I should have went through this 15 years ago. And so with that, even some of the people that are there and it's obvious on the first day that they don't want to be there, they still get something out of it. And Scott and I will give that advisement at the beginning, like just be patient, pay attention, you'll get something out of it. Even if it's just learning about resources. As you get some veteran officers that they've been on a while and they believe they already understand the whole situation and what's going on, but they still get something out of it. So don't give up on them. So the core elements for CIT program is partnerships is number 1, law enforcement, advocacy, and mental health. I mentioned the importance of the National Alliance on Mental Illness as part of our partnership, and behavioral health. Community ownership, planning, implementation, and networking. We never hesitate to have community involvement. If there's anyone that ever wants to participate, we use a lot of people as guest speakers that with lived experience. that are from the community, and it just makes our program that much stronger. Policies and procedures. Obviously, we have to adhere to each agency's policies and procedures. One of the things we did, because we're a multi-agency program, we had to come up with an MOA with the other agencies, because when we first started CIT, there was only a few people trained. So there were going to be instances where we knew a CIT officer might have to cross jurisdictional boundaries. So we had drawn up an agreement, which actually is still in effect today. Odds are, you got a 9 out of 10 chance you're going to get a CIT trained officer when you call 911. But we have always left that agreement in place in case there's ever a circumstance where somebody needs to go into another jurisdiction. Operational elements, CIT officer, dispatcher, and coordinator. I'll talk a little bit more about coordinators later, but those are our key people that receive the training and are targeted by the program. One of the things that I focused on early on to help the acceptance of the program when we decided to do 100% train was I made sure that we got the sergeants and the field training officers into the program. I emphasized each of the agencies to make them a priority, because you want your field supervisors to understand what the techniques are that your officers and deputies are implementing. And you want the dispatchers to, they're the first line people that they may be able to de-escalate the crisis right there on the phone before it even gets to an officer, or they can keep the person on the phone and keep trying to reduce the escalating situation while the officer is responding. So in the curriculum, the CIT training, that's obviously an important element. We're constantly working to improve that program. Scott's the guru that plans and organizes the training academy every time. He's been doing it 11 years now. Does a fantastic job. But we actually, we listen to the evaluations we get from our students, and we've made some changes recently to upgrade the program with more scenarios, and I'll let Scott talk about that later. Mental health receiving facility for emergency services. This is an important element. This is one thing that we're still working on here in our county. Right now, we're still experiencing kind of a road bump where when we have someone that we're placing on a hold, or if they're going voluntarily, they have to go to the local emergency department first, whichever is the closest ER. And that's not the ideal situation, but that's what we're dealing with right now. And there are some plans in the works to improve that in the near future. As obviously the best method is if you can go directly to your mental health facility. I mean, absent the person needing some significant medical assistance, but if they just need a medical screening, your ideal situation is a one-stop where you can just go directly to your mental health facility. Evaluation and research. As I mentioned, we're constantly evaluating and looking for new options. Like I said, this series that's put on by CACITA, I'm going to listen into every single one of them, and I always pick up bits and pieces of other programs and what they're doing, and if it works for us, we'll incorporate it. Same thing with CIT International. I go to their conference every year, and there's a lot of good information that gets put out there and is important that you can bring back to your local community. In-service training, that's very important in that we constantly keep the officers up to date on changes that are happening with the program. What we've been doing is we do a quarterly briefing training where we get face-to-face contact with the deputies and officers around the county, and we'll pick up a topic. Scott and I might recognize a trend, something where maybe the 5150 holds are not being written well, or there's a change in the 5150 hold form. We'll do a briefing training geared around that to give them an update. Since COVID hit, we've modified that in that I'm now doing 3 to 7 minute pre-recorded videos, and then just sending them out to the stations and asking the patrol sergeants to show those at their briefings. So on the positive side, it's been a big time saver for Scott and I to be able to do it that way, rather than drive out to do about 30 presentations around the county. So this is that part's helped greatly. recognition and honors. We do a CIT Officer and Deputy of the Year. Every January, we do a recognition. And to bring our partners in, we actually do the presentation at the Behavioral Health Advisory Board meeting. And at first they were a little hesitant, but once they saw what a great display it was and the recognition of the good work that officers and deputies are doing around the county, they look forward to it every January. The other thing we do is we honor a crisis team worker or somebody that works as a helper of the CIT program that works for behavioral health. So we've, for the last 2 years, we've actually added an award for them that was named after one of their former crisis team personnel that passed away recently from cancer. Developing CIT in other communities, that's a huge part. I talked to you about how San Jose and Memphis helped us. We've returned that favor. We've helped Kern County start their program. Santa Barbara and San Luis Obispo, they both are doing a fantastic jobs with their programs. All we really did is we met with them, gave them some advice, handed them all our materials, and then they ran with it from there. And like I said, those communities are doing a great job. So benefits of a CIT program, immediacy of response. You already have the officers and deputies out in the field so they can get there quickly. Increase officer safety, reduction in officer and citizen injuries, increased jail diversion, increased chance for a consumer to connect with the mental health system, less people falling through the cracks, especially with Felicia will talk to you about the program we have going on right now. Keeps even less people from falling through the cracks. Increase officer confidence in their skills, reduce liability, reduced unnecessary arrests or use of force, avoidance of costs to the criminal justice system, positive perception of the program, and linkages to long-term services promoting recovery for the consumer and services in the behavioral health system. And Scott will show you later what we cover on our training program, but one thing we always try to emphasize is that our job is not to make the officers clinicians. There's no way you could do that in a 40-hour program. So whether they're filling out a CIT card or they're filling out their mental health form to place someone on a hold, we ask them to just describe the behaviors that they are witnessing only. Write what they say, write what they're doing. Don't make a diagnosis. That's not your job. And if the person wants to self-disclose what their diagnosis is, of course you want to document that. But you get officers, some of the salty old veterans, so like, well, they're trying to make me into a clinician. And no, that's not what we're doing. Multi-agency leadership. So this is important if you're starting a program. You have to have command staff buy-in. We were fortunate here in our county that it was actually kind of driven from the top down. As we had there was a task force going in the county at the same time that assistant chief from Ventura Police asked me and another guy and doctor from behavioral health. We went up to San Jose, so it was nice that we had that buy-in from the top immediately. And then, as I mentioned, the sergeants, got to have your sergeants on board. They're that gap between the administration and the line level officers. So to have their buy-in is important, and getting the field training officers trained so that they can instill those de-escalation techniques and strategies when the officers are brand new, and teaching them about the resources that are available. And it's always great to have some champions. Where our coordinators at our individual stations tend to be our champions of the program. So it's really important to identify a couple of those people. And if you have some people in management, that's great. You've got some line level people. So we try, when we use guest speakers or we use helpers for our role play scenarios, we try to pick the people that support the program and show an interest in the program, because we want to keep them motivated and champions of the program. So interagency cooperation, collaboration. Don't let the plan stall waiting for all agencies to buy in. That's something that I learned very early on. When we were starting the CIT program, I was a sergeant. So I had a little bit of clout, but I wasn't like a manager or anything. But one of the things that I did is I just kept moving forward, and I just would ask around other agencies, other department, who's the right person to talk to, who's the person that gets things done, who's going to make things happen. And I just didn't take no for an answer. If somebody said, no, we're not interested, then I looked for someone else in the organization that might be. And I'd encourage you to do the same. Don't get discouraged and don't get stalled by people that maybe are pessimistic, or they already have too much time on their plate and don't want to get that deeply involved. So funding, I know this is always an important question. So we are funded through a memorandum of agreement between the sheriffs and 5 police departments. And what we did is we came up with a formula that was population based. So what we did is we took the number of citizens served in each community, and then based on the population, we assigned a percentage of ownership. So we share the money equally amongst those, and the sheriff has contract cities, so we did the same thing with that. So the unincorporated areas and the contract cities for the sheriffs, that became part of their financial responsibility. And then we receive right now $100,000 a year from our behavioral health department. Extremely important. That funding helps make it easier for the agencies to pay for the program. And what our costs are right now is it's 2 full-time employees, our vehicle, and then basically our office expenses. We're fortunate in that we have a lot of volunteers and people in kind services. They're allowed to go while they're already working their regular jobs to come and help us do the CIT Academy. Scott will get into that a little more later. And we've had a couple of times in the past where we've utilized grant funding to help sustain the program. And usually when we have grant funding, it's kind of giving the law enforcement agencies a break from having to pay for the program while the grant funding sustains it. But they know that they've committed to that responsibility for paying their portion of it. So I got a little ahead of myself on this one, but what our goal is in exchange for that $100,000 that we receive from behavioral health is we're required to train a minimum of 100 Ventura County law enforcement officers. We're going to probably be modifying that agreement in the near future, because as we get near 100% trained on the CIT officers, we obviously we won't have 100 people to train each year potentially. The other thing that we're doing, I neglected to mention earlier, is part of our ongoing training and expansion, we are just launched a new 8-hour CIT update class. CIT International has recognized that CIT is a perishable skill, and that everyone about every 2 to 3 years should go through some type of a refresher. We mainly had covered it in the past through our briefing trainings, but now we're going to have a formal 8-hour update course. And it's both post and STC certified, our 40-hour academy and our 8-hour update class. So things that we provide, we do the 8-hour, 40-hour class. We act as a liaison between law enforcement, behavioral health, and our stakeholders. And which is one of the big ones is the hospitals. So frequently one of our agencies will have maybe a conflict, or something didn't go well on the way something was handled. So we'll call a meeting, and I try to go to all those meetings because I want a CIT to be at the table, because if it happens to one agency, it may happen to another, and I want to be able to share that information with the other agencies so we can avoid those issues in the future. So we provide staff reports on request. We also do a monthly report that we send in with Scott and I's activities. Create training curriculums, briefing trainings I mentioned, and then we do presentations as requested like this one. So the coordinator's role, This is the coordinators are extremely important. Like I said, sometimes they're champions. Sometimes, unfortunately, you get a person that gets thrown into the role, but their main job is to be our first point of contact with that department. Since there's only Scott and I, and there's about kind of sworn and non-sworn, we've probably got about 1,900 personnel in the county that Scott and I are responsible for the training and coordination. So it's important to have local points of contact, and they have the better knowledge of the agency and how the information should be distributed. So we want to maintain and improve stakeholder relationships, work collaboratively with the CIT program staff. We have quarterly coordinators meetings, and then we'll also bring the stakeholders in. So the way we usually work it is we'll have a 9 a.m. start time for our meeting. We'll have just the law enforcement coordinators from 9 to 10. That way we can talk about law enforcement stuff. We can bring up any issues that potentially need to be brought up later. Then at 10:30, we bring in the stakeholders, and we talk about what issues that we have, what issues they have, and then we'll allow opportunities for new stakeholders in the room to kind of showcase what their services are and what they do. We review CIT cards, which we'll talk about a little bit later. Proactive and timely information sharing, recognize and report training issues, and help identify CIT Academy candidates, and they nominate someone for CIT Officer or Deputy of the Year. That is the coordinator's role, key person that we select. So with that, I'm going to turn it over to Scott for the next few slides. Scott, whenever you're ready.
Hey, good morning, everyone. Hopefully you can see me in the speaker view. If not, you might have to switch to gallery view. So we'll talk a little bit about the CIT academies. We've had 53 CIT academies since 2001. That's over 1,900 people that have been trained. We have local law enforcement, out-of-county law enforcement. We told you that we trained other counties, our dispatchers, probation officers, the other essential professional staff, and our instructional team is over 50 people. It borders on sometimes 75 people that come to each class. Mark, do you have the screen control? Mark, if you're muted, I can't hear you a bit.
Do you have the screen now?
I'm looking at the whole PowerPoint combo. I don't know if I see if I
How's
can
that?
switch. Yeah, that's better. I think you're going to have to switch it for me to the next slide, please. Thank you. And so part of the academy hosting is obviously finding the right venue. You got to find a venue that's large enough. You got to have your breakout rooms. You need to make sure, I mean, I get down to all the details. I got to make sure the air conditioning is going to be good, whether it's heat or whatever you need, your parking. And so that's hard oftentimes to find, especially for a large class, is finding a venue that's really going to support you and be able to do that there. Once you get that venue narrowed down and selected and the dates locked in, then you're pretty good for moving forward. We've actually transitioned over the years to those 3-inch thick binders that no one ever looks at again. We actually went down to thumb drives, and then because of the virtual concept of COVID, we actually now went to Dropbox, which is great ways to save money because we were spending $1,000 a year on binders, and you go to Dropbox, and then people can pull the stuff down at their own. Even if you do thumb drives, it's not that expensive. But that's really beneficial to get that material to the students in their hands, because nobody wants to leave a class with a big folder of papers. They want to be able to reference it back later at their convenience. Role play props, make sure you have all those. We have quite a array. I don't have wigs yet, but I think that's coming next. Follow your state certified extended class course outline. I retain copies from each class. That is a learning lesson for me. When we moved our office from Thousand Oaks to Camarillo, we lost some of the materials, and it's unfortunate because you will have phone calls down the road as coming from the defense on some case or some litigation, and you're trying to pull up what those students learned at that time, and that comes in question. So definitely save those materials from those courses. secure, confirm, and reconfirm your instructors? Absolutely. So I have my A team, I have a B team, and even a C team in some cases. So somebody, and especially in the law enforcement business, if that's one of your instructors, somebody gets sick, something comes up, whatever, court, can't get out of it, and they can't be there in the class, you better have someone on speed dial that's ready to go. And we have that. Comfortably, we can cover, and we've managed. It's always unfortunate when your A team guy can't come, but or gal can't come, but we know we have somebody we can get in there to cover. All CIT instructors volunteer their time, so or they're participating while they're on duty. So we don't pay for instructors, and some programs do that. We actually tally this up. We had about 200 volunteer hours, or hours that were put towards. If you think about the manpower and just training 50 students, but having 200 hours of instructor hours, or guest speakers or scenario actors involved in that, that's quite a bit. You know, the one part I might give some deviation to, and not paying someone to do it, is maybe for the actors. It's sometimes finding quality people that can act is difficult. That's the one thing I'm a little short on at times, is finding enough people that are willing to act. A lot of people are willing to judge and evaluate and do scenarios, but to actually act and act out kind of roles sometimes is tough. So I respect agencies that utilize paid actors for those. But you might be able to build some relationships with your community colleges and find some actors there that you can kind of brief and get them on board. Command staff introduction. So unlike most law enforcement courses, there is a police chief or sheriff that opens each course, each CIT academy. And that's really good. It shows the buy-in and the commitment to it. Just make sure the person going there knows what they're saying. We usually provide bullet points. Sometimes we've had chiefs go in there and they kind of slam another program, and you have representatives there in the room. So that's not really great. We did have a sheriff administrator once say, I know this class is going to be really boring at most of the week. You know, that's not a great way to start your week off when someone says something like that. So just give them some little pointers on that. Graduation, it's changed over the years. My understanding from one of the first CIT academies, it was quite an honor. Everyone was in their class A's, and you had police chiefs from all over that were there, and the media taking pictures. Generally, from the students' perspective, you know, and when it's Friday and it's getting near 5 o'clock, they just want to take their certificate, their pin, and head out the door. So it's however you want to do it. But a great way, if you don't do a big formal graduation, is that you might consider just doing a press release when your class is over, and maybe even a group photo for those who feel comfortable being in the photo, and just announcing that what you're doing. Next, please. Mark, I think you have to switch it for me.
Some reason it's not advancing. There we go.
Okay, great. And so this is a sample schedule that we had for one of our last physical classes that we actually had with no virtual component to it. And we will send this out to you guys later. It's kind of hard to see, but it's a packed week. You can see there's very few gaps in here. We do our best to do a 10-minute break every hour. You got to have breaks; it's very essential. But you can see it's pretty well packed. Everything you see in the blue line designates that's an officer of the day. So we like to get one of our CIT coordinators to come in, and they're basically just sitting in. They're learning new stuff, or just refreshing the stuff that they've learned before. And also it's rare, but if you have somebody who's maybe not in line sometimes, and then sometimes the sergeant kind of shoots them a look, and they kind of know to be in line. So it's also a green line that you'll see there. That is our mental health officer of the day. It actually is using it being the person for the week now. So we have a crisis team member from our behavioral health department sits in, and it's great having that the continuity in the week. And frankly, even Mark and I, sometimes we have a cancellation of instructor, or we're trying to get somebody to make sure that they can come in and cover. We might get called out or have to run to the restroom, whatever. So it's also an extra eyes and ears in the room that are picking up on things. And it's a really well packed week on there, and we'll show you this differs from our virtual weeks This is more of a virtual week, we omitting the colors, I guess, on there, but we had to lump all of our role plays and scenarios and physical in classroom stuff on the last day. So it's actually a hybrid week. It's 4 days virtual and then the last day in person, rotating groups no larger than 15 people, and they have to go in different rooms and they're trying not to touch each other, mask, gloves, all that stuff. But that's how it kind of just changed a little bit. It doesn't work as well, and well, I mean, virtual is difficult anyway at times, but the only thing that didn't work as well that we noticed is that on the previous schedule, you would see that we do FOSS scenarios, which are firearm simulator type scenario, force of use, excuse me, type simulators. We usually do that on Wednesday. We find that's actually been really helpful that when students learn things for a couple days and then they practice those skills on Wednesday morning, and if they need some tuning up or we need to kind of help them, point them in the right direction, they're a little more prepared for the actual testing that occurs, the live actor scenarios on Friday. So that there's a benefit to putting some of those things earlier in the week versus putting them all in the back end of the week. But even though we've had this virtual and we've done 2 of these course or hybrid virtual courses, our students actually did pretty well. They're pretty understanding too of knowing that they had to be taking this class in a different way than normally presented, but it actually came out really positive. Upon completion of the course, law enforcement is better prepared to understand the signs and symptoms of mental illness and co-occurring disorders. Obviously, we're not giving anyone the ability to diagnose someone, but to recognize the basic symptoms, recognize when those signs and symptoms are represented in a crisis situation, safely de-escalate individuals experiencing behavioral crisis, and then utilizing all those community resources, which you see on our schedules, a lot of different people coming in and knowing when to connect people, when it's appropriate to connect people to resources so we can divert them from a 5150 or a custody if it's appropriate. Uh, the program expansion here is Ventura County Sheriff's Office is the primary agency. We obviously, Mark is the program administrator. I'm the program assistant. It's the 2 of us that are doing this. And this is all we do, which just really makes this program much more stable when you have that's a set assignment. It's not a collateral type assignment. And we are the centralized location for the program, both physically, virtually, everything, because we are in the center of the county. We're where everyone comes to for information. And our quarterly meetings and our regular contact with CIT coordinators and the stakeholders, it does keep us aligned and it keeps the program thriving. So thank you. And I think it's Felicia. Yes.
Good morning. Make sure I have everything up. Okay. Mark, you're going to run my slides for me, right? Thank you, sir. So RISE is our bridge building to services. And basically in 2015, we were awarded SB 82 triage funds for a grant to go out and outreach to individuals who were those in the community that were difficult to engage in services, high utilizers of service, didn't quite meet the criteria for 5150, but we're kind of at that pre-crisis level. And we are field-based. We provide ongoing support. So it's not just going out and outreaching. We follow them and provide case management activities to help support them get connected to the appropriate service. And we're partnered with CIT law enforcement officers. If you can go to the next slide, please. So our target population for RISE are individuals with serious mental illness. However, we do get referrals for other individuals who maybe are experiencing substance use issues, maybe in the moment. The mental illness seemed like it would meet our target population in terms of being seriously mentally ill, but it might just have been a situation where in that moment they were escalated, but overall the mental health issues are mild to moderate, and so we would help connect those individuals with the appropriate level of care. But the target population that we're primarily focused on are individuals with serious mental illness and an inability or unwillingness to access treatment on their own. That may be due to a variety of factors. They don't have any support. As you know, a lot of our individuals who are suffering with serious mental illness have burned a lot of bridges with their family members, and so they don't have the support and those family members or community members in their lives to help them get connected. Our funding is through a triage grant, Senate Bill 82, which is part of the Mental Health Services Act funding. So it was a subset of funding that we had to apply for in a competitive process and were awarded. initially, when we received the triage funds for the first round of funding, we had, Mark, I think you can go to the next slide. We had individuals countywide who were outreaching in geographically based in several areas of Ventura County. And so in those first 4 years, we actually provided services to 6,400 individuals. We touched, and so what that means is people who we made contact with, but we weren't able to get any more information than just gender and ethnicity. 12,000 individuals. Some of the 6,400 came from that 12,000. During that time, we created great working relationships with law enforcement, community-based organizations, faith-based organizations, hospitals, and schools. If you can go to the next slide, please. So in forming those relationships with our law enforcement partners, they became a huge proponent of the RISE team. And I really like to give Mark and Scott a lot of this credit, because they really provided us with a lot of support to apply for the next round of funding. And in applying for that, what we were able to do is come up with our RISE expansion. So as I was saying before, our RISE team was originally geographically based throughout Ventura County. We had 4 clinicians, 2 which were field-based clinicians that can do assessments in the field with individuals. We had 2 clinicians that were co-located in our inpatient psychiatric unit. So individuals who got hospitalized and were not connected with services, we had the ability to complete the assessments in the hospital and get them connected. And then we had community service coordinators, which are kind of a higher level case management team. So these people are very clinically savvy. They have been with our department for a very long time. And they had the ability to not only go out into the community and connect people, but they would build those relationships with those community providers and law enforcement. And so with our RISE expansion, what we were able to do in 2018 was get a second round of the SB 82 funding. And we decided we were going to have 2 separate RISE expansion teams. So with our first team, we're focusing on TAY-age youth. And these are TAY-age youth as defined by the state, so 16 to 25. And we have, with that team, we have 2 behavioral health clinicians that go out into the field and provide the assessments, 2 community service coordinators, 2 peer recovery coaches, and these are folks with lived experience, and 1 parent partner to work with the parents of some of these youth that may be struggling. Our second part of the RISE expansion, which I think is more applicable here, and this is where Mark and Scott played a big role in helping us develop this piece of our RISE expansion, is our law enforcement partnership. And so with our law enforcement partnership, we have community service coordinators, case managers who are paired full-time with law enforcement agencies. In July of 2018 is when we were supposed to go live. However, there were budget cuts at the state level, and we had to look at, okay, how are we going to adjust this without losing a big piece of our law enforcement partnership? We were able to reduce by 1 community service coordinator. We were able to partner with Ventura PD and Oxnard PD full-time. We looked at the data to see the number of homeless, population, hospitalizations, jail days, and determined that our 2 largest areas that were in the greatest need for full-time partnership was Ventura and Oxnard. And then what we did is we took 2 community service coordinators and we split their time between Simi Valley Police Department and Ventura County Sheriff's, which covers our Camarillo and Thousand Oaks area. The unique thing about this partnership is, many states and many counties have been doing a first or a co-responder model where you have a clinician or a case manager paired with law enforcement to respond to crisis calls. And so the way we approached this partnership, since we already had a 24/7 crisis team, we approached this partnership as more of a proactive prevention type of model. So they actually manage caseloads. And with our person of concern meeting, as you see on this slide here, what we did initially to kind of develop these caseloads is, out of the original RISE program, we developed this person of concern meeting, where we would have monthly meetings with the leadership of Ventura County Behavioral Health and law enforcement. So we'd have a representative or a couple of representatives from each law enforcement agency throughout our county and our CIT folks. And we would sit down, and each law enforcement agency would bring their top 3 to 5 persons of concern, or their highest utilizers of emergency services. And then we would brainstorm, how would we approach these individuals? And so in the development of the law enforcement partnership team, we took those individuals on a caseload. And so these may be folks who are not connected to services. These could be folks who are connected to clinics, but kind of aren't fully engaged, or maybe disconnected, hadn't been in a while, but there are lots of calls to service. And so we go out and we actually case manage these clients together. And of course, we try to get releases of information when we can. We always ask the client's permission when we interact with them. You know, is it okay if, I'll use one of our officers as an example, if Officer Dyer listens in on this conversation, and if they say no, then the officer will take a step back out of ear's reach, but will stand by just for safety purposes for the case manager. But what we found is, in working these cases together, some of our highest utilizers that have been individuals who previously, you know, when they saw law enforcement approaching, would run the other way, didn't want to have anything to do with them. And now we actually have, pre-COVID, we have law enforcement interacting with these individuals and bringing them to doctor's appointments. We've had them actually transport them to our office for doctor's appointments. And so what we're seeing is this level of trust and these relationships being built, not only with the case managers, but with the law enforcement officers. And the communication flows. When we do have releases, we're able to speak openly with law enforcement, but law enforcement is constantly giving us information and updates on these individuals so that we can better serve them. And we've seen a reduction in hospital stays, and we've seen a reduction in jail days. Next slide. And I'll hand it back over to you, Scott.
Thank you. And really, we value that relationship with behavioral health, and especially with the RISE team. It filled a void that we had for years, and not having someone that was able to go out. And so it's been a big benefit to our community. So talking about a CIT program, providing information to the community, we do presentations on the CIT program. And we have all kinds of questions that come from family members. You know, what do officers do? What are they trained in? How do they handle situations? Even up to, how do they take care of my mentally ill loved one that's in the jail? And we talk about our TIM unit there, and all the great work that they do there. So those is really good to have that interaction with the community, and they feel comfortable asking those questions. We've hosted mental health first aid trainings in our community, and we participate in all these different community and stakeholder events, whether it's, you know, putting up a resource table, or you know, just going to a classroom of 15 people at the college, but we present that information out there, and it keeps the CIT information live and ready for people to use when they need it. Next, please. And just some of our partners. We have many more partners than that, but just some of our partners that are key here in our community. And then a little bit the CIT cards. Mark mentioned it. We actually used to do paper CIT cards, which you see in the upper right-hand corner. But now most of our deputies and officers are using the iPhone app that we have, which is called ICOP. It's a proprietary system that the Sheriff's Office built and extended it to the other police departments in the area. And they enter the mental health information. We currently ask about 60 questions, which I'll tell you which is great for us to pull data from, but it's way too many for the officer in the field. And so we're going to revise that, and we're going to knock it down to about 30 questions. So just the real pertinent stuff that we really need to know. But data collection helps you in identifying your persons of concerns, your red flags, your familiar faces, and it helps you know what you're doing right, and where you need more training needs. And it's beneficial to have that. Next, please. And just some of the studies that we've had have come back with this information. We have a third-party vendor that's through Behavioral Health Department that assesses the officers' take on the CIT Academy, and so they remain anonymous in the surveys. But the information we've come back from that surveys have shown that 88% of the officers, their contacts result in verbalization only versus use of force. CIT officers are less likely to use force. They're 3 times more likely to have contact only dispositions versus jail or 5150s. They're 2 times less likely to use jail, and they do handle CIT calls faster. And in addition, what the officers have said from that is 100% have benefited from the training, which we knew everybody would benefit from. And half of them said very much. And 30% said they use the new skills very often. 95% feel that they could better recognize a mental health disorder. And 92% feel better able to handle a call involving mental illness, which is great results and show that your CIT Academy training is really productive. We've also asked family members. We've surveyed some of them and asked what their thoughts about CIT officers. As you can see, 9 out of 10 are saying that the CIT trained officers better able to recognize the mental health disorder and able to de-escalate that crisis in a satisfactory manner to their liking. Next. Oh, and that's our conclusionary slide there. You have our contact information. Please feel free to reach out to any one of us. We're happy to share information. We share everything. As we got everything from San Jose, we'll do the likewise for you. We'll share whatever information we have and our best practices, and we'll probably learn some great tips from you too. So we appreciate that.
One last thing I'd like to add is one of the things when we're doing our presentations, we always emphasize to people in the community that when you're having a mental health crisis, request a CIT trained officer. And even though you have a 90% chance of getting a CIT trained officer in our community, I think it changes the mindset of the dispatcher when they hear that request, and it changes the mindset of the officer when they receive that call, knowing that it was a request for a CIT trained officer. So that family disturbance call you're going to, combined with they requested a CIT trained officer, I think is a little bit of a red flag for the dispatchers and the officers responding to the call. All right, with that, I will stop the screen share.
Okay, Mark, this is Tamika, and we did have a question that was posted into the chat, so I'll go ahead and I will read that. How does your CIT program differ from other law enforcement agencies' peer support programs?
Each of our agencies in the counties have peer support programs, but we're not involved in our peer support programs, if I'm understanding their question correctly.
Yeah, it was posted anonymously, so I don't know if the person wants to clarify in chat.
Okay.
And if anyone else has any questions, you can raise your hand to speak if you would like to ask that question, or you can post it into chat, either way. And so we'll just wait a moment. Let's see here. We do have another question. Are your CIT officers and clinicians riding together in the field?
Only from what Felicia described with the partnership that we have going on, that's the only circumstance where we have that going. It is something that we've considered looking at in the future. When we first started investigating what was the best program for community, we looked at CIT, which is training officers as specialists. Then we looked at the co-responder model. But at the time, financially, it didn't make good sense for us because you had to have a full-time dedicated officer and a full-time dedicated clinician out in the field. So ideally, if you could do that, that would be great. In combination with what we're doing right now, we would love to go to that in the future and expand that.
Okay, thank you. And then it looks like, I hope I say this correctly, Terezi Boher. I'm going to go ahead and unmute you and you will be allowed to talk. They have raised their hand to ask a question. Go ahead and unmute yourself and you can ask your question.
Thank you. I'm interested in your best practices. Can you give us a little bit more information on that?
Well, it coincides with what I talked about our goals. Our best practices, we follow the Memphis model CIT program, which is, most people tell you that's the gold standard of crisis intervention training. So they've been around since 1988. Last I knew, they were in 48 states and 5 countries around the world. So it's that is pretty much the standard that we follow, and best practices, in the sense that we teach officers that CIT is one of the tools on their tool belt. It's not an absolute. You know, there are circumstances where an officer arrives on scene, gets out of his car, and he's immediately engaged by someone with a weapon. And, you know, you have to protect yourself and your own life, and in turn protecting the community around you. Did I cover that?
I'm going to add one thing in there.
Okay.
If you haven't attended the CIT International's coordinator course, you really should. I recommend that. I remember sitting through that course. I was already 8 years into working with CIT, and I just wanted to hit my head and go, I wish this class was offered 8 years prior, because I learned the hard way in a lot of those things. So there's really good best practices that come out of that CIT coordinator course, if you have the time to attend that.
And if you go back into our PowerPoint, I covered 10 steps on how we run things organizationally and with the community. Those come straight from CIT International's best practices. And if you go to their website, you can download, they now have a program guide where it talks about all the best practices for CIT.
Okay, and let me look in chat. It looks like we have another question. Can you share a narrative about a recent call that led to a 5150 hold, subsequent follow-up for ongoing mental health support and support for family?
Scott, can you think of any recent cases that you could share?
I'm sorry. I was thinking maybe Felicia would have a really good story, maybe through the assist side of things.
Yeah, actually, I can share some story on that. So because our program is really closely connected with our mobile crisis team, which operates 24/7, we often get referrals, we being the RISE team, where crisis team will go out, maybe meet up with law enforcement on scene, or it's just crisis team called out on a call. And if they see, so everything that we do is documented in our electronic health record. And when crisis team is dispatched to go out on a call, they look in the health record to see, okay, is this person a client? Where are they connected to? And if they're not connected, what they'll do is they will then make a referral once they've written that, even if they haven't written a hold. So if it's a 5150 or not, if that person's not connected, they will do a referral to the RISE program. And so we've set up a central referral email box where all of our referrals come through there. We triage those referrals, and we look at, okay, what is the appropriate place to refer them in terms of geographically with our RISE staff. We will try to engage the individual while they're in the inpatient unit to build that relationship and develop that rapport. Additionally, if we're able to, then we can do the assessment while that individual is still in the inpatient unit. So as they are discharged from the hospital, we already have them connected to a clinic and ongoing services. One of the struggles we have here in Ventura County is the lack of inpatient unit beds. And so many of our folks will get sent out of county. That presents challenges. We do get notified of which hospitals they're admitted to through our quality improvement department. However, because of billing, and sometimes that takes a while, by the time our quality improvement division receives the bill for authorization of services out of county, then what happens is we get that information from the RISE team to do follow-up, but they've already been discharged from the hospital. So that can present a unique challenge there. But typically we'll get those referrals usually the same day that crisis team has gone out, and we're able to follow up and connect with those individuals to help connect them to services.
Thank you. And then we have another question. It says, in what instances does the crisis team go out to a scene without law enforcement?
So the behavioral health crisis team, they can respond to calls independently of law enforcement. Generally, from my understanding, is that if there's any active aggression occurring, or possession of a weapon or firearms that are kind of in play in this scenario, that's when they're going to ask law enforcement to come assist. And in that case, law enforcement is going to kind of stand by and take the safety measures in that and let crisis team do the bulk of that intervention. But generally, law enforcement and crisis team are two different things, and they could both respond to calls and they could both go independently of each other. So, but generally, as long as they're going to be safe, they can go on calls on their own.
Okay, and I don't see any other questions. Did anyone in the room have any additional questions for the panelists? While we're waiting for folks to decide if they want to ask a question, I did want to just take just a moment in honor of Veterans Day, which is tomorrow, which is dedicated to the cause of world peace. It actually passed in legislation in 1938. Wanted to say thank you for any officers, veterans. I should know better. My dad was in the Air Force, my husband was in the Army, and my daughter's actively in the Army. Also to, wives, parents, and any soldiers, just thank you for your service, and just wanted to take a moment to say thank you on behalf of CACITA. And with that, I don't see any other questions to those, to the panelists from anyone in the room.
You should also say if there's any Marines in the room, happy birthday. It's Marine Corps birthday today.
Oh, yes, there you go. And so thank you guys, because I mean, at the end of the day, everyone in this room serves in some capacity their community. And I just think it's very important to definitely acknowledge our veterans and thank them for their service for sure. But with that, let's see here in chat. You just guys got a lot of kudos, a lot of awesome sessions, and thank you, Mark. A special thank you sent to you. I will go ahead and since I don't see any other questions, turn it back over to Marla for the closing, and thank everybody who took some time to spend with us today. So Marla.
Thank you.
So as Tamika said, happy Veterans Day to everybody. And thank you for taking the time to be with us today. It means a lot to the California Crisis Intervention Training Association that you attend these trainings and have an opportunity, as Mark mentioned at the beginning of the training, that you have an opportunity to see best practices throughout the state of California. We will be sending information for our December training where we will have an opportunity to highlight the San Mateo program. And this program will emphasize the relationship with the EMS and the firefighter paramedic program. So it's a little bit different than some programs in our state. And I think you'll find that information very, very valuable. So with that, thank you very much, Ventura County. Great job, great program. Keep up the good work. And for all of you, have a safe and healthy day. And we look forward to seeing you at the training in December. Take care.
Thanks for having us.